This week, ABC News is taking a deep dive into the toll that the pandemic is taking on racial, ethnic, and socioeconomic disparities in communities across the country. In New York alone, African Americans are twice as likely to die of the virus. How concerned are you by this? And how should the Senate address this, since it is something that, you know, we know there's a disparity. This is just exacerbating it. What should people be knowing?
You hit it, Whoopi. We know there's a disparity, and this is exacerbating it. Why is it that so many people of color are more likely to get the disease? Why is it that so many more people of color sadly pass away of the disease? And the reason is very simple. Communities of color, minority communities, and poor communities don't have adequate health care and haven't for a very long time. And so what we have to do is first make sure that resources, I'm making sure, for instance, now we've given the states money to do testing. They should do testing in the poorer communities above all, because that's where testing can do the most good, and it's so important. We should make sure that there is better health care for everyone, that everyone has health care. In COVID-4, we said that no matter what your income, your testing and treatment for COVID will be free of charge. So many people, poor people, people of color, have to stay away from getting adequate medical care because they can't afford it. It's either feeding their kids or getting the right health care. So one of the lessons, Whoopi, that I hope we learn from this crisis and permanently fix it is getting better health care for everybody. That would make a huge difference, and when, God forbid, the next crisis comes, maybe we won't have these disparities. We've also asked that the administration give us detailed data so we can see exactly where things are affected. All too often they hide it. And one other thing, we have made sure in this second round that small minority-owned businesses, we're working very hard on that, get some of the lending to the small business programs. In the first round, if you knew a big shot banker, you got the money. But if you're a small little businessman, particularly in the inner city, particularly person of color who didn't have a relationship with a bank, you didn't get it. In the second bill, we have made that happen in a much better way, and things are getting better. We have to do the same, which we've done in this COVID-4 bill, for health care.
Senator, as you said before, make sure that the testing goes around? I'm sorry, Megan. I was just saying, can you make sure, Senator Schumer, that the testing gets to people, like people in the projects, people in low-income areas? Because I noticed the testing is not given to everyone, and that's bothered the hell out of me. I'm sorry, Megan, I didn't mean to jump you.
No, but Whoopi, you're so right. And let me just say one thing about testing. This has been one of the greatest failures of this administration, and I hope they learn from it. I want us to come together and solve this problem for people's sake, not get political advantage. But the bottom line is, Donald Trump said on March 6th, everyone who needs a test can get a test. It's just not true. And the countries that have done a much better job at solving this problem, at overcoming this problem, are countries like Singapore and Hong Kong and Australia and New Zealand and Finland and Germany that have had much stronger testing programs than we have had. It's been a great failure. By the way, you'll be happy to know the heads of state of 5 of those 6 countries have something in common. They're women. They did a better job than the men. And the bottom line is, if we had adequate testing in the poorer communities and in all communities, it would make a huge difference, and we'd overcome this crisis more quickly. And in reference to Megan's question, we would more likely be able to avoid the second wave, because we'd know who has it early on, and we could sort of nip it in the bud.
Yes, I hear everything you're saying. And as you said earlier, I understand that you want people to get back to work. You don't want to see people suffering. But we see a lot of people protesting these stay-at-home orders all over the country. And there are businesses that are actually defying their governors, and they're reopening local stores. Even in our own local paper this morning, the New York Post, in your home state, this is the cover. It needs to end now. People are desperate to get back to work. If we don't do something soon, what will be left for people to come back to? And this is the question me and all of my friends, I feel like we're saying every night, what are we going to come back to? Is there any way to have a happy medium where we can have a slow open, where small businesses just won't be decimated by this?
Well, I think we have to have a balance. As I mentioned, my dad being a small businessman, I know exactly how you feel. He spent his life putting his blood, sweat, and tears in the business, and if a pandemic comes and you have to close down, it's just heartache as well as financial loss. And so the bottom line is very simple. We have to have a balance. You can't listen to somebody who just says we have to just listen to the health experts. On the other hand, you can't listen to somebody who says just listen to the economic experts. Bring them together and come up with a balance. So in New York State, we've opened up most of the upstate areas that had much less COVID. We've been slower to open up New York City because it's had so much COVID, but with good reason. If you open up too soon and it comes back at you, those businesses will never survive. So there has to be a balance. And I would say one thing, Megan, you can't let newspaper headlines, and I know that one was the New York Post, or 1,000 people protesting determine the policy. You have to have experts, true experts. And what New York has done is it's combined economic experts who understand the pain of keeping businesses closed with health experts who understand that you can't move too quickly, try to come up with a happy medium. And it's worked out pretty well because the upstate areas are much more open than New York City, and that's probably the right solution.